Well, first of all, I'm a physician by training, a psychiatrist by background and training, and have had a wonderful career in medicine in a whole range of places. I've been on the front lines in a health manpower shortage area in the Virgin Islands, working in the inner city in Washington, D.C. I've had an amazing opportunity to work and be trained at the National Institutes of Mental Health. And I've been in the pharmaceutical industry for some years now and have had an opportunity to work both in clinical development but also working in interfacing with people with health products. And of course, I spent some years at Howard University in the Department of Psychiatry working and training medical students and residents. I've been affiliated with the ACU for many, many years, since my early days in the National Health Service Corps and my frontline service in health manpower shortage areas. And I am so pleased and proud of the work that the ACU did then, and with the phenomenal track record that it has now. It's just such a pleasure to be working with this organization.
Tell us a little bit about your work now with the media and how you're able to reach patients in a completely different way.
Reaching patients is clearly what it's all about. It's where all the action is and where it's the outcomes, where the outcomes really happen. And we've started to use media, meeting patients where they are, on television and on the web primarily. And there are two shows that we work with, both CBS properties. One is The Doctors, which is a television program that has 4 doctors that answer questions and bring up issues that people need to know. We do it in simple language, but we continue to rely on cutting-edge science and information so that people have what they need to make the decisions that they make day on day. The other place that we've had a wonderful opportunity to meet patients is on Rachel Ray, where we use, I guess, more lighthearted opportunities to educate, doing makeovers from head to toe and inside out, so that we talk to people about how their beauty challenges may in fact be related to health challenges, and that we want them to age healthily on the inside and on the outside.
So this has been, you've been a champion for patient engagement and bringing patients in. Tell me how your other work in your career has helped to increase that kind of information and knowledge of patients so they can better take care of themselves.
I feel now that my career has really culminated in my ability to use all of my experiences to help people stay healthy if they're healthy and get healthy if they're not. So I started in a health manpower shortage area in Washington, D.C., right there on the front lines in a psychiatric practice, and spent some time in the Virgin Islands as well. I was also in an academic center where research, learning more, using our experiences with patients to teach us and to teach them, and that has been an incredible addition to what I do now. I also had a chance to learn even more from the National Institutes of Mental Health in an individual faculty training program, as well as some time there as a special advisor. And then, of course, my work at Howard University, where I taught to learn, if you would, teaching medical students and residents, and that amazing experience allowed me to put together trainees and patients on behalf of better learning and better teaching. And I've spent the last part of my career in the pharmaceutical industry, where I've learned the trials and tribulations and the wonderful opportunities in treatment, development, and deployment. So learning how to discover, develop, and deliver groundbreaking therapies.